It's time for this week's segment of Happier at Home. This morning, we're discussing voice changes as people age.
We are, and we are joined now by our friend Deb Marcella with more for us this morning. Deb, this is a very interesting topic, and I don't know that it's one that we've touched on before.
We certainly have not, but many people deal with this as they're aging. The larynx, which is your voice box, your vocal cords, and your voice producing mechanisms all work together for your voice and your projection. And just as the rest of your body ages, your voice may change with aging. And this may have to do with the muscles and other tissues in those areas changing, such as vocal cord shrinking, stiffening, and thinning, those types of things. So that can cause some changes as we age.
And that is a normal part of the aging process, or is this something that only a few people will experience, or only a select number of people will experience?
It really is a normal part of your aging process. It is pretty frequent. So I'd say with what I've done with my research, about 56 to 60% of those that are aging have some kind of changes. It can be something having to do with heredity, your decreased hormones. So all of our hormones start decreasing about age 45. So these changes in your voice can even start as young as age 50 and just continue on as we age too. It can be caused by medications. Oftentimes there might be drying of your vocal cords as you are taking different kinds of medications, thinning of the blood in the body, which can cause some bruising or hemorrhaging of the vocal cords. And then also trauma, which that can be physical trauma. It can be if you're overusing your voice, and also with the different medications. If you do have some trauma, it could enlarge your vocal cords, which can cause some changes in your voice as well. So with these changes, your voice box may thin. The mucous membranes that line these different anatomical structures that make your voice, they may be thinning as well, and those stiffening of the connective tissues around there. So you might notice as you age, especially men, their voice pitch may be higher, and then in women, it may become lower. Your voice might become shaky. It may reduce the volume that you might have. So these types of things, it's, even though it is a normal part of the aging process, if it's affecting your communication, if you don't like what's going on, you should see your doctor. You could talk with an ENT, and it may be a multidisciplinary approach to treating anything, but wanting to know what the main cause is would be where you start.
And once you get that cause, I have to imagine you can hopefully find some sort of solution to maybe reverse some of that, some of the aging in those muscles. But is there anything people could be doing now? People, in their, nearing their 40s, or as you make your way to 50, to maintain that vocal strength as you age?
Well, you should, if you do have a sudden change, definitely see your doctor, because if you're young, you're in your 40s and you're having voice changes, you may have a polyp, you might have something else going on that needs to be diagnosed. But certainly treating your voice well, so sometimes we overuse it. Keeping very hydrated will help to keep those mucous membranes lubricated, which helps to project your voice. But this can also be a genetic thing. I know my father, his voice sounds like the Godfather. And that's how my grandfather sounded. But certainly seeing your doctor, staying hydrated, knowing if there's any medications that are affecting your voice as well. But they can treat you with speech pathology. So they would start with the lesser treatment first. If
And
there's
go up
some
from
kind
there.
of anatomical or physical thing, maybe surgery
Deb
as well.
Marcello, happier at home. Thank you so much for your time. More information on foxrochester.com.